great to be here. Um, I always think it's really good at this time to kind of think about why we're here, and why is it that you take time out of your Saturday morning when you could be doing anything and everything to keep life going, that you've chosen to come and spend this hour and a bit with us. And essentially, this health hour is for you. It's for you as an individual. It's for your network, for your family, for your friends, all of those in your community, in which we really want to prioritize health and health education. And it is focused.
It appears we might have some technical issues. Hopefully,
For
Dr.
people
Vanessa.
of
Dr.
African and
Vanessa,
Caribbean descent. You best
Dr.
share
Vanessa.
that. Hi.
I'm sorry,
Hi.
your internet just cut out momentarily there, so we lost part of what you said. Do you mind
Oh,
repeating
I
the
was
sentence, please?
No, no, no. Thank you so much. And I should make a declaration to everyone, just not to annoy those of you that are in the UK at the moment. I've just left the UK and I'm in Ghana. I got here today. So if my internet is unstable, many apologies, and I'll turn my camera off sometime there. But yes, we are here for you to educate and to share with you as well. And essentially, we really want people to have the kind of empowerment to take control of your health and also to support others as well. Um, because it is for you, please feel free to ask questions in the chat whilst the speaker is speaking, and I'll go through them at the end. And if I can't answer, if I can't ensure that everything is answered, then we will ensure a way to feed back to you. But please do get involved, because that's the best way for these sessions to be the best that they can be. And it would also be great if you could share where you are, so your location, and if you're watching with family and friends, that's also great to know as a community together. Um, One other bit of housekeeping before I hand us over to our amazing speaker is that please be aware that we are recording. So, and that's important because we want you to be able to watch it again at any time. We want you to share the link with your networks. So if you don't want to be seen, please do turn your cameras off. But as I said in the question and answer, if you do feel comfortable to put your camera on or put unmute and share in the question and answer, we'd love to hear from you. So without further ado, I'm going to hand over to Dr. Ayo, who is a consultant in acute medicine based in Mersey. He has a number of other hats, in also being a transformational coach, and works in many dimensions, and also with young people. But something I loved, when we were just speaking earlier, he said, first and foremost, he's a husband and father. So really understands the importance of just making sure that our families are connected and informed. So it's wonderful to have you here. And we're going to be hearing from Dr. Ayo about testicular health. So over to you.
Thank you, thank you, thank you very much, Dr. Vanessa. And is it just me who's jealous about the fact that she's somewhere that's, not raining and cold? So, Dr. Vanessa, you've been down in my estimation because of that. So just want to make that clear. So yeah, thank you very much, everybody. What a wonderful, wonderful Saturday morning to talk about testicular health. So for those of you who haven't met me before, my name is Dr. Ayo, and we're going to have a good time. Now, the thing about testicular health and any sort of sexual health conversations that it can be a little awkward or taboo, depending on your personality and your culture, but we're not going to do any of that today. So we're going to have a conversation that you're going to enjoy, that's going to be really informative, that your husbands, brothers, fathers, yourself are going to be able to use to be healthy for a long time. So let's get going. And in the spirit of irreverence, I have labeled my talk ball handling. Ball handling, testicular health.
I love it.
So let's get going. So who am I? I always start these conversations with thank you, just like Dr. Vanessa said. You could be anywhere doing anything, but you're here with us, doing what you can to inform yourself about your health and the people that you love. So thank you for spending your time with us. I am a Christian. I'm a husband. I'm a father. I'm a son. I'm a coach. I'm also a brother and an uncle. I'm a coach. I'm an author. I'm a consultant in acute medicine as a hobby. And as a caveat, just to clarify, I'm not an expert in urology or testicular health and things like that, but I am a man. And I don't know whether you notice, I'm black, you guys. So I thought it would be useful for us to have this conversation because these things relate to me. I want to be as healthy as I can, and I want my brothers out there to be as healthy as they can as well. So let's get going. First off, I'm going to start with Happy Men's Health Month. Now, I hope this is not controversial here, but there are some places in the world that are diminishing the role and importance of men in our societies, in our families. And I want to let you know, Black man listening to this, we need you. We need you around. We need you in our homes. We need you in our families. We need you in our community. You are important. And your health is really important. So please, here, we appreciate you. Thank you for everything that you do. I don't want that to go without saying because, again, some places in society, these kinds of things are not being said. So, Black man, we need you. And that's why this conversation is important, because we want you to take care of yourself so that you can be with us for a long time. So what are we going to talk about? We're going to talk about testicular health. So we're going to have an introduction to your testicles, not yours if you don't have them. We're going to talk about the importance of testicular health. We're going to talk about common conditions affecting testicular health and habits for good testicular health. I'm going to keep saying testicular health and testicles so that we can break down any sort of taboo. We're going to have to talk about how to check your testicles and when it's a good time to see your doctor, the specific impact of health inequalities in Black people. So if you're ready for that conversation, give me a 1 in the chat or a fire or a dance. Give me something in the chat and let's keep going. All right, so I've put this slide here on purpose because, you know, I remember doing a conversation with Khan and we talked about palliative care and death. And in the Black community specifically, sometimes there's a taboo about talking about health issues across the board, and specifically when it comes to sexual health and in men testicular health. So men in general, we don't talk about our health. We specifically don't talk to our brothers about our testicular health. So what do we call testicles? We call them testes, testicles, balls, rocks, ball sack, nuts, gonad, stones. Why have I put these on? Because, you know, we're going to get rid of all the taboos today. That's why I've got all these pictures on. One of the things I think is really important is that when it comes to these things, they're just words. They're just words that mean something else, and you ascribe meaning. So for instance, if I was to insult you in French and you didn't understand French, it wouldn't mean anything to you. And the point I'm making is that there are some parts of our culture and society who think that the conversation about sexual health, testicular health, prostate health, breast health is dirty. It's not dirty. If you're a man, you have testicles. And I want those testicles to be as healthy as possible. Again, I'm going to keep saying testicles because I want to break through any discomfort. There's nothing wrong, nothing dirty about your testicles. They were created by God for you to live a life that you need to live. So let's get over all of that. Now, what are testicles? They are 5 centimeter long, egg-shaped balls, if you will, objects, and they're in your scrotum. The scrotum is a muscular sac at the bottom of your penis. Yes, I said penis. The 2 major functions of the testicles are testosterone production. So testosterone is the hormone that makes a man a man. It makes a boy because genetically we all start off as with a female. In medicine we would call this a phenotype. We would look like a woman, and the testosterone is a thing that changes for you to become a male. And it's involved in sperm production, in making sure that we can continue our families moving forward. So that's what testicles are. What is testosterone? So testosterone is produced by the Leydig cells. It's a bit of biology there for you. But Leydig cells are in your testes, and it's a hormone, again, crucial for the development of physical characteristics. Now, biologically, testosterone is the thing that makes you a man. We know that there are so many other things in society that make you a man. But biologically, testosterone is the thing that does that. Now, testosterone is important because it helps you develop facial hair, a deep voice. It helps you with muscle mass. It also plays roles in your sex drive and mood regulation. So fluctuations in testosterone and low testosterone can make people feel depressed and helps you maintain your energy levels. That's the function of testosterone. It's produced by the testes. In fact, if I can go back to this slide, one of the reasons why it's important for us to know the names of things when it comes to the parts of our body is protection for our children. There were some studies that found out that when a child knows the name of penis, testicle, labia, vagina, it reduces the probability in the future that they can get abused by an adult or another person. So jokes aside, it's really important when we're having conversations with our children to name the parts of the body with the appropriate name. It's actually very protective. So we're going to talk about some common conditions that affect men and our testicular health. Obviously, the one that everybody is concerned about is testicular cancer. It's actually the most common cancer in young men between the ages of 15 to 35. And early detection, just like anything, any cancer and lots of other medical conditions, improves survival significantly. So the warning signs of testicular cancer are things like lumps, changing size, and aching in the scrotum. And we're going to talk about how to check your testes later, but those are the things to be worried for. Testicular cancer can also result in sexual dysfunction, erectile dysfunction, and things like that. And interestingly, it's more prevalent in white men, and ironically, Black men have lower survival rates, which I found very interesting, and we're going to talk about why that might be true later. So testicular cancer is the thing that everybody's really concerned about, but there are ways of making sure you can have good testicular health. We're going to talk about that and advice about how to check, when to check. In the Black community, there's often delayed diagnosis because, again, men in general don't check themselves. There might be a cultural stigma. We, as Black people in general, engage with healthcare less quickly than our white brothers and sisters. And we don't talk about our health with other people. I remember having a conversation with my auntie, and she was saying that, maybe when we were in the village, back in the day, me exposing a problem I had with health would be ammunition for my enemy. So that's become something that we're culturally doing today. I don't know. All I'm saying is that we need to do better at settling in ourselves. I'm going to take care of myself, which means I may have to have some uncomfortable conversations. And it's protective from my community if I normalize that. So how do we improve outcomes in Black men? Education and awareness. So conversations like this, which is one of the reasons why I'm so respectful of what Khan is doing in our community. You're literally saving lives. Access to healthcare. Now, in the UK, that's not such a big deal, but it can be an issue in other places in the world. And that's why we need people like Dr. Vanessa being in Ghana and other places in the world and the charities and the NGOs to make sure that our brothers and sisters can access healthcare and community engagement. Again, conversations like this. When you watch this video, share it with your friends, send it to your uncles, your dads, your brothers, because the information is then getting out there, and then have a conversation about it. Now, testicular torsion is another problem that you can have in terms of testicular health. So in your scrotum, you have a few things that go through the top of the scrotum into where the testicles are, and you have the spermatic cord, which carries sperm from the testicle to the penis, and the suprachiasmatic cord can twist, and the body needs blood supply for all its organs to work. So if you have a testicular torsion, what's happening is that you have lack of blood supply to the testicle, and the pain is horrendous. It actually is a medical emergency. It's rare, but there's some data to suggest that Black men may experience it, if they do experience it, at younger ages than our other racial groups. But it's a medical emergency. It's characterized by severe pain in the scrotum, worse than getting kicked in the balls. So it's something to be really important about. And unfortunately, testicular torsion, if not dealt with as an emergency, can lead to infertility. So something to look out for, but it is rare. So a varicocele. So here's a picture of the stylized picture of the testicles. You have here the testes and the blood supply to the testes, which can get swollen in the same way that you have varicose veins in your legs. You can get varicosities in the supply to the testicles. So it's similar to varicose veins. It can lead to infertility, but it's not usually dangerous in a sense of life-threatening. And the warning signs are, again, a feeling of heaviness or swelling in the scrotum, and the evidence does suggest that it's more prevalent in Black men. So, sorry, I'm going backwards. So a hydrocele. Now, a hydrocele is a fluid-filled sac that is alongside the testicle. It's really common in newborns, apparently, 10%, and in the adult population, it's 1%. It's irritating and not serious. I'll tell you a story. When I was a urology F1, I was in my first year, there was a gentleman who had come in with a hydrocele, and I'm not joking, this hydrocele was as big as this cup. And it really made me ponder, and it's what we're talking about today. Human beings, we get used to things, or we put things to the back of our minds, and we don't engage, or we don't seek help when something starts. How is it possible that this person could have a swelling in their scrotum this big and not engage? It didn't start that big. It must have started small. And it was interesting to me as to what was the mindset for this young man waiting months before presenting. Again, is it shame? Is it stigma? Is it whatever it was? But again, it was so interesting to me as a doctor that he'd taken so long. So the point I'm making is that whenever there's an issue, especially with your testicular health, when you check and you realize that there may be a problem, that's the time to engage. So epididymitis is an infection in the epididymis. So going back to this picture here, this is the epididymis here. It collects sperm and sends it to the penis. So epididymitis is an inflammation and infection of that area. It's usually, it can be caused by sexually transmitted diseases or urinary tract infections, and the symptoms are pain, swelling, and fever in the scrotum, because pain, swelling, and fever are the symptoms you get with any sort of infection of inflammation, any itis, but you get it specifically in the scrotum. And the treatment is antibiotics. So you have to engage, you have to go to the GP, you have to go to your working center, you may get sent to hospital. The data is equivocal as to whether it's more common in Black men. But there was some data that suggested that sexually transmitted diseases may be more common in the Black community. And again, there's a link between sexually transmitted disease, but it's not statistically proven as yet. So how to check your testicles. Now, the thing to remember is the best time to check is when you've had a warm shower, because the muscles in the scrotum are relaxed and you have more access to all around the testicles. So how to check is, so I'm going to use a tangerine, obviously not to scale. What you want to do is you want to get your fingers and your thumb and fingers. I'm going to stand up. Where's the camera? Around the testicle, and you're feeling for lumps and bumps, and you want to feel the area all over for lumps and bumps between your hands. Now, most lumps and bumps won't be cancerous. That's the first thing to say. But if you do feel any sort of lumps and bumps, that's the time to go and see your GP. So again, after a warm shower, you check each testicle at the time. You're feeling thumb and forefinger, and you're going all around and feeling for lumps and bumps. I hope everybody is as uncomfortable as I was standing up, holding a tangerine around my groin. Okay, that is how you check. Now, why don't we check? Again, this is part of the conversation about shame or avoidance or mistrust. I know that there are some members of the Black community who aren't trustful of establishments like the NHS because some of the staff that look there don't look like them. As a Black doctor, I implore you that it's still better for you to engage than not to engage. It's not in your interest to avoid an engagement with healthcare because you don't trust the doctors or the nurses or the nurse practitioners, especially because, as with most things in healthcare, the later something is detected, the less options we have from a treatment point of view. And again, thank God for Khan. By now, hopefully you're realizing that there are an increasing number of our Black brothers and sisters in healthcare. So if you needed an advocate, if you were concerned about, the treatment that you were given, there are people you could discuss with. I'm sure you can have a conversation with Khan and say, my GP's told me this, or I've been told this. Can I just make sure that I'm happy with the advice? But you miss 100% of all the chances you don't take. And if you need to engage and you don't, the only person that is responsible for a potential negative outcome in the future is you. So I implore you, please check, please engage. We need you. Now, when to see a doctor? If you detect lumps or changes in size of your testicles, that's a good time to book an appointment with your GP. If you get persistent pain or swelling in the area, that's a good time to book an appointment with your GP. If there's a sudden change in how your testicle feels, and again, extreme pain, I would argue if you get extreme severe pain, go straight to A&E because testicular torsion is a medical emergency, and there are some time constraints and issues where we need to do something like now. I hope that makes sense. Lumps, bumps, pain, swelling. Go and see your doctor. Now, most of us are grown-ups in here. Let's talk about sex. Is there any sort of link between sex itself and testicular health? Now, there's no link between sex and testicular cancer. There is a link, as we've talked about before, in the probability of epididymal orchitis or epididymitis because of promiscuity. So multiple sexual partners and increases the risk of STDs. And as a consequence of that, there's an increased risk of infection. Abstinence actually reduces your sperm count, which I found really interesting. And again, I know we're talking about testicular health, but sex reduces the risk of prostate cancer, again, which I found really interesting. The data that I saw suggested that men need to be having sex where they ejaculate up to 21 times a month. So that guy must not have been married. But that's what the data suggests. So I'll just leave that there. So lifestyle changes. What can I do to make sure that I am taking care of my health for my future? Because let me put my coaching hat on now. We are so focused on today, and you forget that 10 years is going to come whether you do anything or not. So what would your 10-year-older self want you to do today so that in 10 years you can be as healthy as possible? Leafy greens and vegetables. They're rich in antioxidants. So, I mean, there's lots of examples, but these are some of them. Spinach, kale, broccoli, Brussels sprouts, leafy green. The darker the green, the more iron and the more antioxidants that's there. Nuts and seeds. They have healthy fats and they have zinc, which again is useful for your blood supply, blood pressure, and good for testicular health. Examples that you can use in your diet are almonds, walnuts, sunflower seeds, pumpkin seeds, and flax seeds. Now, there's lots of data about lots of things, and some of them might seem contradictory. If I eat this and it's going to be against this, I'm talking specifically about testicular health. Oily fish, they're rich in omega-3 fatty acids, which we know are useful for our cardiovascular health and also for testicular health. So where can I find examples of that? Salmon, mackerel, sardines, and herring. And again, so I'm not a big fish person, but I don't know where I had a stroke in 2020. And as a consequence of that, I did my best to change my appetites so that I aligned the things I was doing with making sure that I'd be healthy for as long as possible. And it's like there was a time in my life when I would have 3 cups of 3 sugars in my tea. And I never thought I'd be the person who didn't have that because I like the sweetness. And I realized that, well, this is not healthy for me. And I just reduced it. And the thing to remember is with these lifestyle changes, if you do them consistently, your tastes will change. I don't drink tea anymore, but when I do drink tea, I don't really put maybe 1 spoon of sugar. And if I was to put the amount of sugar that I was using before, it would be too sweet for me. So I want to reassure you, it's about consistency, but if you do these things, even if these things aren't in your current habits, you'll do them eventually, consistently, your taste will change, and actually you'll look forward to it. What other things can we do? So tomatoes are rich in lycopene, which is really useful for testicular health. Whole grains, they're high in fiber and vitamin B vitamins. And where can you find them? Oats, quinoa, brown rice, barley, whole wheat. Citrus fruits and berries, very rich in vitamin C. Did you know that kiwis actually have more vitamin C per volume than oranges? So that's something that I found interesting. Strawberries, berries, oranges, papayas. So these are all things that you can do and add to your diet if you're not doing them already for your testicular health. What else can we do? Avocados, they're rich in healthy fats and folate. Actually, your body needs healthy fats. Your brain needs healthy fats. Your testicles need healthy fat. So avoiding all fat might not necessarily be healthy for you. Eggs are rich in protein and vitamin D. Garlic boosts testosterone and boosts circulation. And pomegranate has lots of antioxidants and anti-inflammatories. So again, especially as we're meal planning and looking at our future, we can say, okay, well, how can I eat in such a way that gives me what I need today so I can be healthy in 10 years' time? Now, I am in my 40s, and I know I don't look like it, apart from the gray hair, My wife keeps asking me my wife was talking to me before about dyeing my hair. And I'm of the opinion I have earned these grays. And plus everyone's seen them now, so it just looks strange. So what can I do as I'm becoming an older man about boosting my testosterone? Exercise and strength training is something that you can do to boost your testosterone, because having higher levels of endogenous testosterone. Endogenous means you produce it in your own body, is protective, it's healthy for you. Again, it helps you with your muscle mass and it helps you with your bone density. And funnily enough, exercise and strength training is the only thing that has been proven to help you cognitively as you get older. So forget all that brain stuff that you're doing on your on your phone. Exercise and strength training and maintaining a healthy diet. We've talked about this, zinc and magnesium and healthy fats. Manage stress. My goodness, this is such a big such a big topic. But managing your stress is so important in life today. There are so many ways in which it has an impact, high levels of stress and cortisol. Cortisol actually, the high levels of it reduces your body's endogenous levels of testosterone. Therefore, again, and we know that cortisol itself, high levels of it for a long period of time is harmful to your body. So manage it. Manage it. One of the things I find myself telling my patients when I'm meeting them in hospital, when they come in with symptoms, and when we pick it apart, we're able to reassure them, okay, you've not had X condition. I think this is an anxiety issue. And it's very reassuring because they might have thought they had a heart attack or a blood clot and stuff. It's very reassuring to say it's stress or it's anxiety. And on top of that, I always say, well, what are you doing to manage your anxiety? Because often we don't think of it as something that we have to deal with intentionally, but especially when it comes to your general health, but specifically when it comes to your testicular health, please be intentional about managing your stress levels. Just as an aside, I don't know whether you guys watched Supercell on Netflix. My wife pointed this out to me. One of the things that I thought was really, really well shown is that all the men in the program had people around them that they could talk to. And maybe it may be a challenging thing to start a conversation about health or testicular health specifically, but having community around you, men, creating that space where we feel safe to talk about the things that we're dealing with actually is productive from a mental health point of view, from a stress point of view, and now we've figured out from a testicular health point of view. So if you have close friends, men, and I mean other men, let's protect that space. And if you don't, let's create that space. Losing weight. Excessive weight actually reduces your body's production of testosterone and increases your body's production of estrogen. So losing weight will help you from a testicular health point of view. Avoid excess alcohol and drug use. I mean, we know about it from a social ills point of view, but specifically about your testicular health, it's protective. Optimize vitamin D. So as often as you can, as early as you can in the day, you want to try and get sunlight and increase your magnesium intake. So specifically spinach, almonds, and pumpkin seeds. So now you would think that if high levels of endogenous, so again, produced by your body, testosterone levels are helpful, then, maybe I could just help that by using something, testosterone from an external source. No, you'd be wrong. So people, I know none of you guys do it, but maybe somebody is involved in this, especially people who go to the gym, or somebody who does that. They might be tempted to use anabolic steroids. Why is it not a good idea? So there are some conditions where people have low levels of internally produced testosterone. So as doctors, we have to give them testosterone, but the anabolic steroid use will give you 10 or up to 100 times higher levels of testosterone than we would prescribe as doctors. So it's harmful levels. And if you use anabolic steroids, they normally do them in cycles, so over a series of days, it can take up to 47 weeks, that's most of the year, for your body to recover. Your body works on what we call a negative feedback loop. So for instance, For most hormones, there is a sensor in the body saying, do I have testosterone? Do I have testosterone? It's sensing it all the time. And if I don't have testosterone, what it will do is it stimulates my testicles to produce testosterone. Then this sensing system will realize, oh, I've got testosterone, and then it will send a signal to my testicles, stop producing as much. So it's called a negative feedback loop. But if I give my body testosterone from another source, this sensor doesn't know that it's coming from an external source, and it will just tell my body, stop producing testosterone. So actually, anabolic steroid use can cause you to have chronically, irreparably low levels of testosterone long term, because it's so much higher than the body produces. It can produce testicular atrophy for that reason, because your testicles aren't being stimulated. They're not doing their work. So atrophy is essentially shriveling up. The word, the phrase, you've heard it before. If you don't use it, you lose it. And it can result in hypogonadism. So hypogonadism is a medical term that talks about a low level of sexual hormones in the blood, in the body. So it gives you reduced libido, erectile dysfunction, and low sperm count. So if you're willing to risk all of these things for looking bigger or better, I mean, it's up to you. I would strongly advise against doing it. Again, we've talked about the high levels of estrogen being an issue with increased body fat, but anabolic steroid use actually increases your estrogen levels and can cause you to have gynecomastia. That's the medical term for an increase in the breast tissue in a man. So men and women have breasts. They're just bigger in a woman. Gynecomastia is an abnormal growth of male breast tissue. It can cause, anabolic steroid use can cause chronic liver disease, and it can actually cause cardiomyopathy, which is heart failure. Honestly, I've seen it. I've seen young men who come in and they're breathless, and they're in their 20s or their 30s, and they use anabolic steroid use, and now their heart is massive, akin to a 70, 80-year-old some person who's had heart failure for 20 years. Please, anabolic steroid use is not good for your health. So in summary, your testicles produce testosterone. They are the thing that gives you the physical characteristic of being a man. It is important for you to check your testicles monthly, and I showed you how. Black men in general have worst outcomes when it comes to most testicular health issues, and we've talked about the fact that that might be because we don't present early enough. There's a shame associated with talking about our health, and we don't have, there may be a bit of a distrust about healthcare. And I want to end on this note. Black men, we need you. We need you, regardless of what's happening in society. Your wife needs you, your children need you, our community needs you. So we need you to take care of yourself. Thank you.
Thank you so much. Fantastic as I expected, as always. But I really wanted to just I love that you ended on it and you also started on it, in terms of Black men, we need you. And it's something I'm always really conscious of, because I do a lot of work for Black people's health. I do a lot of work specifically for Black women. And I sometimes I feel we don't say that enough, that nothing is zero sum. So if we're talking about one group, doesn't mean we're ignoring the other, and actually recognizing that we're a community. So just remembering that often men do get lost in the conversation. And so thank you so much for highlighting that. And there's been there's been a lot of positive feedback in some of the private messages to me. So people have really appreciated you saying that. So I just wanted to start off with that. So thank you so much. We've had questions coming in through the chat. Also through YouTube. So thank you so much, everyone. And also privately, please keep them coming. And we'll try our best to get through as many as we can. Before we go on, I also just wanted to give a shout out. I think we have a great event going on in London at the moment, which is a London Inspire event, which is focused on, I believe it is Black women in South London. But we have over 30 people joining us from there. So giving a massive shout out to everyone there. Thank you so much for joining us today, and hope you enjoy the rest of your sessions there. So one of the first questions is relates to why we're here today, and acknowledging some of the stigma and concerns. So I've got a mum who has said that she has a 16-year-old and an 18-year-old as a 21-year-old. So number one, congratulations to the mum that shared.
Well done, Auntie.
But has commented on how does she foster more of these issues, and they just kind of shrink. So how can she support more of these conversations
Sorry,
with them?
Dr. Vanessa, we lost you for a minute. Would you mind repeating the question?
Oh, sorry. And if it continues, everyone, I'll turn my camera off. But it was a mum with three boys ranging up until 21, just saying that how does she foster conversations about male health? Because she finds that when she tries to speak about it, they shy away, and she doesn't have many male figures in their lives.
Okay. I mean, I suppose in this situation, I'm assuming that the dad is not in the picture. So I think it's a very difficult and challenging situation, because I was having this conversation with some of my friends about like how does a single parent bring the other aspects of parenting that the other parent would bring. So I think my answer would be maybe obviously you want to create a shameless family, reduce shame in conversation just in general, because I know that some of us were parented with shame-based parenting, and that's the kind of thing that we're perpetuating. So that reduces the probability that my son or my daughter will come and talk to me about something that they may see that I think is an issue. I think that's number one. Let's do that across the board. I think number two is that specifically in this situation, there'll probably be some men that you know, or that they know, who you can say, there is something that as their mother, I might not be able to help them with, or they may not feel comfortable talking about. So specific, like ask directly, can you have conversations with them about this? Or and not like do what a lot of our parents did. Oh, this is your uncle. Okay, talk. Bye. you know, let's create the environment where they know us, we know them, we talk about football, we talk about games, we talk about business, we talk about studies, and part of the conversation is also about yeah, and genitalia health, specifically testicular health, sex, because I think this is the burden of parenting. My responsibility is to help you in areas that you may not even necessarily want my attention. And I think this is where the phrase, it takes a village to raise a child, really comes to fore. Like, for instance, I obviously I'm a man, I have a son, and I am making sure that the men in my life are he has access to have conversations that he may not specifically about sexual health per se, but he may not necessarily want to have with me. So my brother's a business mogul, so and he knows more about that stuff than I do. So if my son wants to have a conversation about business, well, speak to Uncle B, and so let's foster these kinds of things. And I believe our sister said that she may not have a lot of men, so you may have to go and find them. You may have to go and find them and say, okay, I'm looking for somebody to help me in specifically this area. So is it church? Is it community groups? And there are probably more groups online nowadays than they were when I was growing up. So there'll be somebody that you can direct your children to say, this is a male role model that I'd like you to get to know better. Sorry, that was a bit of a long-winded answer. I hope it I hope it helps.
No, no. I think it's so important because I'm sure there are many other people on the line in the same position or reflecting about it. Because as you say, sometimes even when we have both parents there, we may not be the right people to speak about it to, but signposting to our moguls in the family who
Yeah.
know more and can facilitate that more. So completely agree. So one of the questions is there any physiological reason why Black men are more predisposed to these conditions? Someone suggested more melanin, more testosterone than our non-Black counterparts. So just thinking about the reasoning and
Yeah.
behind it.
So there hasn't been anything that I found in my research. So a lot of the stuff is associative data as opposed to like a causative thing. So I couldn't tell you, I don't know necessarily that it's a melanin thing and stuff. The things I know for sure is that in general in the Black community, we don't present early. Our health seeking behavior is less than other people. So when somebody's having chest pain or headaches or swelling in their groins or stuff, we will put it off. I mean, some people suggest that, like, we've got bigger fish to fry. We've got to take care of our kids. We've got to pay bills and stuff. And from a Maslow's hierarchy of needs point of view, if you are in a situation where you have more concern about your immediate needs in life, so food and shelter and all that kind of stuff, you have less time to be concerned about things that might seem ethereal. They're not immediately a threat to my health, so let me just focus on going to work and stuff. So that would be my interpretation of the data. I don't know for sure that it's a specifically as Black people we are more susceptible.
Thank you so much. And the the ejaculation comment has had a lot of back and forth, both online and privately, been said to me. So, but someone said that they've also heard about the data suggesting ejaculating at least 21 days a month, but when are you classified as a man? So what age is this from? And someone said this feels a bit excessive
Yeah.
and they're going to masturbate. So what would be the
Yeah.
advice
So
to
this is a
receive the quota,
fantastic.
achieve
Thank
the
you.
quota?
Thank you for the
Yeah.
question. So in short, I don't remember where the cutoff age group was. And I am a Christian, so I am going to talk about married men. Because I think that when we're talking about masturbation and I mean, there's even some data to talk about like pornography and stuff like that. We're talking about something else because, so this is my opinion. Um, God created marriage so that my wife can help me satisfy my needs and desires, and I can satisfy her needs and desires. And the world has come. This is my opinion, so don't shoot messenger. The world has moved in such a way that we understand some of the benefits, some of the things that God created, but we don't put them in the box that God put them in. That is protective. It's protective. Now, when you have conversations about things like masturbation and promiscuity and stuff like that, because you could use that argument 21 times to say, well, I should have lots of sex with lots of different people. What you're not doing is looking at the why. So, for instance, there are some people who masturbation and pornography is an escape from the difficulty that they're having in their life. So from a mental health perspective, that person is not well. There's a degree to which you could even say, are you trying to escape from your life? And society labels some things as obviously bad. So somebody who is who's got alcoholic liver disease or who uses drugs and all that kind of stuff, that person is uh, uh, in general, we label those things as bad, but a lot of us, so and that person is having difficulty dealing with life from potentially from a mental health point of view. So that is their form of escape. But how many of us use something else that might be more societally acceptable, but the core issue is the same? I'm not comfortable with where I am. I'm not happy. So the excessive, the masturbation and the pornography and the promiscuity is an escape. And I think that's the conversation we're not necessarily having about this issue specifically. I mean, 21 times, yeah, that's a lot. That's a lot. um, you know, I mean, you won't have time to do literally anything else. I would argue, I mean, this is a conversation to have with your wife. And I should have said that, married men, after this, it's time to call a board meeting with your wife and say, look, doctor's orders. um, However, I think that there's a bigger conversation about the darker side of all these other things, because I don't know that the people who are advocating, masturbation and promise and lots of sexual partners are necessarily weighing up what the cost of these other things are.
No, I love your answer there because first of all, I love that you had your own disclaimer. These are your thoughts,
Yeah.
but having an honest response to it, because again, why I feel such spaces is so important, because when you talk about cultural competence and making sure it's in the understanding people's cultures and where they come from and what they believe. Your answer embraces that, is that this is from your perspective as a Black man, as a Christian, this is how you would rationalize, explain it. And even having this conversation and hearing it, I think there's just lots to be learned from. And I think we need to kind of take this approach in many other areas of health as well.
Yeah.
And I am smiling and reflecting, because many people are thinking, gosh, in their own personal lives, 21 days, how is it possible? So everyone's bringing it to themselves. So which
So
is what we do.
disclaimer.
Yeah.
I read that and laughed. I was like,
Yeah,
nah, there's no way.
exactly. Yeah.
There's
So
no way.
we're not putting undue pressure. We're just sharing what research is
Yeah.
out there and doing that.
Excellent.
But thank you everyone for engaging and responding to it. So that's fantastic.
Absolutely.
Just before we go on to a bit about testosterone, someone has commented, and I love this. I don't love tomatoes, but I do love ketchup. Can we consider the sauce as a reasonable alternative?
I mean, if you consider eating chips as one of your 5 a day, I suppose that's what you can. So again, it's to me, it's a very similar answer to the one I just gave. There's we have to be honest with ourselves. We have to be honest with ourselves. So I don't like tomatoes either, but I do like stew. Now the thing to ask yourself is that if you want to get the tomatoes and you're using tomato ketchup, are you prepared to pay the price that everything else with tomato ketchup would cost you? So the sugar content and the salt content and all the ingredients, because it's not a zero-sum game. You can't have tomato ketchup without having all of these other things. So if the aim is to be healthy, and specifically I'm using testosterone to help boost my testicular health, am I really being healthy by taking ketchup? Because yes, it will have the properties of tomatoes in it, but it has so much other things that from a risk-benefit point of view, am I really winning? And I think, just like as you said, having that kind of mindset widespread through a lot of the other things that we're doing, I think would really, really help. I think that's the conversation that the guy needs to have who wants to take anabolic steroids. Yes, it will make you bigger and stronger, but it's going to cost you something. Do you want to pay that price?
No. Completely. And again, I love the community on here today. So someone's given a suggestion to our friend who doesn't like tomatoes. Cherry tomatoes are sweeter than other tomato varieties within the family. So you may want to try cherry tomatoes before relying on ketchup. So no,
Yeah.
thank you so much to people. So you were talking about testosterone, and someone has asked about don't women have testosterone as well? And wondered if you could give an idea and compare the difference in levels between men and women.
I mean, I'd have to research it because I don't have that information in my head, but both men and women have testosterone and estrogen, yes. But it's the high levels of estrogen in a woman that makes you a woman, and it's the high levels of testosterone in a man that makes you a man. So I don't know that I have an answer that's more in depth than that. I'd have to look up the levels.
Yeah. So, apologies, I was on mute there. No, completely. And what I would interject, so my experience of testosterone in women when I talk about it is often in the context of menopause, because some
Mm.
people will say, oh, I've been advised to take testosterone as part of my menopause treatment. And for some women it is appropriate, but that's one-to-one decision making and, like, understanding for yourself. But I generally say as well that like you said, it is an important hormone for women as well.
Mm.
And women do typically have naturally lower levels of testosterone. And when I use it in for those that are menopausal, it's kind of relative levels as well, and whether it's appropriate. But yeah, more details can be had on one-on-one
Yeah,
questioning.
yeah.
Yeah.
And again, one of the things I really like about the Khan, these health hours and the conversations is that so at best, this is going to be a whistle-stop tour of this issue. Somebody's doing a 4-hour presentation on testicular health at some point in the world. So never think that this is all inclusive. And if it's something that piques your interest, there's lots of information out there. And one of the big things I've really been impressed with, Khan, is the emphasis on us as a community to take responsibility for our health. These conversations for me, I'm like, okay, I heard when I've hosted, I've been like, oh, this is really interesting. I'll go and do some research. And then because of the thing that I've heard, I now know more about it than I did before, but it helps me. And as doctors, I would say that there's actually a limit to the things that I can do that's going to help you with your health. The person in the driving seat is you. So if you find some of these things and they pique your interest, there's a lot. We could all watch less Netflix, and scroll online. Maybe look at a reputable website. That the NHS has fantastic information about these sorts of things. And again, if you are struggling to find somewhere, reach out to Khan, and I'm sure they can find somebody who'd be able to point you in the right direction.
Thank you. I thought the Netflix one was pointed at me. That's
Oh,
one of my
no,
biggest doubts.
no,
my
no.
my own guilt, my own guilt. No, but it is so true. And I think also, just picking up on what you said, um because we do have limited time in the health hours,
Mm.
we pick broad topics. But if there is a topic that really resonates and you would like more detail, and you would like another health hour where we go into more
Mhm.
detail about certain things, please share that, because we're only we can only do our work based on what you suggest as well, because it's meant to be for you. Great. So just as I kind of bring all the questions together, there was just another question that was sent to me about it's a bit about prostate health, and the gentleman wrote that it's great to hear more about testicular health, because we often hear more about prostate rather than testicular health.
Yeah.
But we're saying that with the prostate, um, how often should he be checked for his prostate? I don't have the age or any other details, but I thought maybe a kind of a banner update about
Yeah. So I think the thing
prostate
with
screening.
prostate health is that we have a slightly different system in the UK than we have in America. So in America, I think it's over 50, they just have a regular test, and it might be a yearly thing. In the UK, our system tends to be based on symptoms. So the thing to be concerned about is, as a man, if you have issues with your urinary stream, so it's not as strong. The question I tend to ask is, can you wee against a wall? Um, like you could do when you were younger. So urinary stream, are you waking up at night to wee? Are you when you finish weeing, are you dribbling? You know, and do you have any sort of bloody discharge in your, those kind of things would be a time when I would say this is a conversation I need to have with my GP, and it will result in a prostate exam. And again, for some people, that's the reason why they don't engage. But it's important because prostate health is a big issue in the Black community. My understanding is 1 in 4 Black men, if forgive me if that's wrong, may have prostate cancer in their life, and we are at higher risk of getting prostate cancer in the Black community than in the white community. So it's important. Now, interestingly, sex helps with that as well. So everyone get married and and stuff. And after this, call your wife and say, doctor's orders.
I love it. Just and then you'll be getting messages from the wives as well.
Yeah. I'm sorry, Auntie.
They're going on from there. No, I love it. And I just wanted to end on some comments that have come through. One giving us some info and a bit of something funny. So someone has just reminded us, because when I think really related to what you were saying about finding spaces for our boys and men to go to, and someone reminded that it doesn't feel like it, but youth groups still exist, and there are various youth directories based on demographics, industries, and regions that are still run, and youth councils, are popular and have details. So really emphasizing on what you said there, Dr. Ayo. So thank you to the person that wrote that. Really, really helpful. And then we've had a wonderful contributor today, and he said, isn't it funny that all the fruits you've suggested resemble the shape of the organ and that it's meant to exhibit health benefits for? So
No,
just bringing that up.
Jokes aside, I saw this thing on a meme on Instagram, basically saying, because like God is so fun that a lot of the things that help you with specific parts of the body look like that part of the body. So walnuts help with your brain, and berries help with your test. Like, it's honestly, I think it's amazing. And I think personally, I think God did it on purpose. Just like, here's a clue, guys.
No. I love it. I love it. Well, Dr. Ayo, thank you so much. That was fantastic. Thank you so much for the answers to the questions as well, because I think a lot of people learned from the presentation itself, but I think the questions really directly relevant to lives and people's perspectives. So thank you so much. It's been great to share the screen with you.
Can I say one more thing?
Oh yeah, please.
You mentioned about like youth groups and stuff. So, and I just thought about it. So some of our boys are doing things like martial arts or football or other sporting stuff. And for instance, my son is in a football club called TRW, and they have brought in people to talk to them about mindset, and stuff like that. And I just thought, actually, this would be a wonderful opportunity to suggest to them, why don't we talk about testicular health or prostate health or sexual health? Because the boys are there already. They have camaraderie already. So if you have your sons in these groups, there's no reason why you can't approach the coaches and say, this is you have a captive audience already. Can we just try having a conversation about these things and normalize it here? Because if often poor communication and misinformation happens in darkness. And as a parent, I know that I'm not the only place my child is going to go for information. So if I can bring light and information to specifically that space, then it increases the probability that they're not going to be misinformed.
No, great. No. Oh, thank you. That's a perfect way to end today's session. Thank you so much. A huge shout out again to those watching that have been watching throughout this morning. We thank you for your time, and those that are watching from the event in London, in Lambeth. Great to have you here. And I'm going to hand over to the wonderful Ruth from Khan to give the announcements. Thank you so much.
Thank you so much, Dr. Vanessa and Dr. Ayo, for a brilliant session. And it was great to see all the questions and comments. Very, very good thoughts throughout. So I have a few announcements to share in terms of what Khan's going to be doing over the next few weeks. So I will just share my screen and hopefully you'll see it in a moment. Okay, can everyone see my screen? Thumbs up? Yeah? Okay, great. So we have a few things coming up this next week. So we will be returning for Health Hour next Saturday, the 30th of November, and we'll be looking at oral cancer. So we've got our dentist specialist, Dr. Ivy Fortune Glavy, who'll be taking us through that next Saturday, same time, 11 a.m. It'll be the same Zoom joining link that you've used today. So please do join us for that. Then, as we all know, in the winter, we're paying a lot more for our bills. It can be a time that causes anxiety and stress. And if you are concerned about keeping up with your bills, we'd love for you to get in touch with Shout UK. You can text warmth to 85258 to get help, or you can scan the QR code that you see there if you've got your phone out, and you can access the website to try and get in touch with them and get some help. So as Khan, we have our community carol service taking place on Wednesday, the 11th of December at Manchester Cathedral from 7 p.m. We'd love for you to join us. It's a free event. Everybody is welcome. And it'll be a time of reflection, a time of celebration, and a time of looking ahead to 2025. So we'd love for you to join us. I've already dropped the link in the chat box. So if you use that now, you can sign up very quickly and then it's done. Save the date in your calendars and we would really love to see you there. Then thank you to everyone that's joining us from London. Give us a wave. So this is the event that's taking place at the moment, our Reclaiming Black Women's and Family Health event. If you're not aware about our London Inspire programme, this is a programme that runs throughout the capital in all of London's 32 boroughs, carrying out health screenings, health interventions and such. So if you don't know much about that, we'd love for you to email us. You can email info@khan.org.uk, or you can head directly to our website to find out more about what we're doing in London. And if you are in London right now, there is still time to join because the event has pretty much just started. So they'll be over there till 4 p.m. So yeah, you can head to our website to find out more, or you can take a picture of this slide now for the address and all the details that you need. So become a Shero Health champion. Hopefully you can see that okay there. This is an opportunity to get involved in Black women's health and making a difference for Black women. So if you head to the email address stephanie@khan.org.uk, or you can call the number on the screen there, which is 07385608 to find out more about how you can make a difference when it comes to Black women's health. We'd love to hear from you. Baby loss is a difficult topic. Here at Khan, we are keen to have conversations, as we've done today, that are difficult. And if you have suffered from baby loss, we have an event coming up that we would like you to register for. If you head to the website that we've got there, that's portal.khan.org.uk/baby loss bereavement support. You can find out more about what we'll be doing to enable people to get through some of these really difficult seasons of life with specialist counselling support from our Black-led team. So if that's you, please do not hesitate to get in touch. Okay, so IBD, inflammatory bowel disease. Again, maybe a topic that sometimes we might feel a bit awkward about talking about, but if you are keen to get involved in this, you can get a £10 e-voucher. So, hey, that's a bit of an incentive, isn't it? You can share your views with us in a 15-minute survey to help Crohn's and Colitis UK, who we're partnering with for this particular research project. The survey closes on the 6th of December, so why not just get involved now, find out more information now, and then it's done and you can get your voucher in time. Okay, so our Black-led counselling service, I alluded to it earlier with the baby loss bereavement support. I've also dropped the link in the chat box. So if you would like to have somebody to talk to that understands your culture, has that cultural competence, that religious sensitivity, we have a Black-led counselling team that works from 9 a.m. to 9 p.m. So you can find a time that suits you outside of work or before work, and you can get that specialist support from our very well-equipped team by emailing counselling@carn.org.uk or following the link that I've already put in the chat. On the 1st of December, we will be coming together in Manchester for a commemorative service to remember those that have died from HIV and those that are living with HIV and AIDS. So if you are based in Manchester, we'd like you to sign up and join us as we not only remember those that we've lost, but also think about the changes that we want to make to HIV-related care so that people can continue to live lives with a relatively good quality of life, seeing as health interventions are improving all the time. Okay, we've come to the end of our session today. Really grateful to all of you that have joined us. It's been great to have you engaging, your questions, your comments, and I want to thank Dr. Vanessa and Dr. Ayo once again for a really engaging and informative session. Hope you have a great rest of your weekend, and please join us next week for our next Health Hour. Thank you. Bye.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our Health Hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.